CDC estimates that more than 21 million cases of acute gastroenteritis are due to norovirus infections each year. Noroviruses are a group of related single-stranded RNA non-enveloped viruses that cause acute gastroenteritis in humans. Norovirus is the official genus name for the group of viruses previously described as Norwalk-like viruses, or small rounded structured viruses, because of their morphologic features. Noroviruses are named after the original strain, known as Norwalk virus, which caused an outbreak of gastroenteritis in a school in Norwalk, Ohio, in 1968. Currently, there are 5 recognized norovirus genogroups, of which 3 are known to affect humans. More than 25 different genotypes have been identified within these genogroups. Noroviruses are transmitted primarily through the fecal-oral route, either by consumption of fecally contaminated food or water, or by direct person-to-person spread. Environmental and fomite contamination may also act as a source of infection. Evidence exists for transmission due to aerosolization of vomitus that presumably results in droplets contaminated surfaces or entering the oral mucosa and being swallowed. Noroviruses are highly contagious. As few as 10 viral particles may be sufficient to infect an individual. During outbreaks of norovirus gastroenteritis, several modes of transmission have been documented. For example, initial foodborne transmission in a restaurant, followed by secondary person-to-person transmission to household contacts. Although pre-symptomatic viral shedding may occur, shedding usually begins with the onset of symptoms and may continue for 2 weeks or more after recovery.
Beatrice Politi joining me now for some important health news. And if you thought this was a bad year for the flu, just wait. I understand, we should be bracing now for a hit from the norovirus.
Exactly, norovirus, and sometimes we call it the Norwalk virus. It's often referred to as the winter vomiting bug. It's already here in Ontario with outbreaks in Sault Ste. Marie and Bruce County and Toronto, too. You can't hear it, and maybe that's a blessing, but Larry the vomiting robot is intended to help UK scientists study how norovirus spreads. Just a few tiny particles of norovirus can infect, and they can stay alive for some 12 days as well.
The attack rates can be between 50 to 90% in secondary contacts.
In comparison, influenza has an attack rate of between 30 and 50%.
Do you want to have a look at this?
And unlike the flu, there is no vaccine for norovirus.
There are many, many different strains of norovirus, so just because you've had infection with one strain, you're not protected for any of the other strains. So you can get it many, many times because there's many, many strains.
British Columbia has seen its highest infection numbers in several years, which some say may be because of a new strain called the Sydney strain.
It doesn't matter whether you've had a norovirus infection before, you will not have any immunity to this new strain.
Though Toronto has seen 13 outbreaks since September, it appears the new strain hasn't arrived quite yet.
But I would not be surprised if we do have it here.
When will you know?
We should know within the next week.
One study recently suggested alcohol-based hand sanitizer doesn't work against the bug, but some say that's not entirely accurate.
You need 70% for norovirus. Those hand sanitizers are very good for bacteria, but not for norovirus specifically. So read the label and get the 70% concentration if you can find it.
With an early flu season, getting hit with yet another virus could be a double whammy.
Because we're already stretched past our maximum occupancies already. So if we get another wave coming in, it will make things very, very difficult.
Norovirus is spread through contact with feces or vomit. Keep in mind the virus can live on surfaces for a long time. Usually it's 12 to 24 hours after contact, sometimes 72 hours that you get sick, and you're sick for about 48 hours. The danger is dehydration. Most people recover quickly, but it can be more serious for those with other health conditions, the very young or the elderly, etc.
Of course. And of course, now we know that robots do just about everything. They even vomit for us.
They do. They can be programmed to do anything.
And this is to explain how projectile vomit will propel the virus all around.
How far, exactly. How far in what direction, that kind of thing.
Okay. We've been warned. Thank you, B.
You're welcome.
Contrary to some opinions about vaccinations, a new study has found the measles, mumps, and rubella vaccine is indeed safe for children. The journal Pediatrics released a report Tuesday that analyzed more than 20,000 studies and 67 papers on the topic. The research determined vaccines for measles, mumps, and rubella, or MMR, do not lead to autism. The study comes on the heels of a report by the Centers for Disease Control and Prevention that indicates a rise in measles across the U.S. Most years only have 60 cases of measles. But in 2014, there have been 539 cases so far and 17 outbreaks across 20 states.
Recently, we've heard about these huge measles outbreaks, and really the reason for them is that people are choosing not to vaccinate their children.
Time points out researchers hope the study will help dispel fears MMR vaccines are linked with autism. While the vaccines can occasionally have side effects of fevers or seizures, the report concludes the MMR vaccine is not associated with autism. The autism vaccine link started with a 1998 study linking the MMR vaccine and autism. Despite that study being debunked and retracted, public figures such as Jim Carrey and Michelle Bachmann have been vocal about their opposition to vaccines. One co-author of the Pediatrics' most recent study told USA Today, "There's a lot of misinformation out there about vaccines. With the rise of the internet and the decline of print journalism, anyone can put anything on the internet." Another co-author said, "This report should give parents some reassurance." This year's measles outbreak in Ohio is the largest outbreak since 1989 in Houston, where pediatrician Dr. Carrie Byington witnessed the disease firsthand. She told Health Day, "I saw myself about 1,000 cases of measles in children. I saw 6 pregnant women and their babies die. These things stay with you because knowing it was all preventable, it's heartbreaking." In 2000, the U.S. declared measles had been eliminated as a disease native to the country. For Newsy, I'm Lauren Goris.